Coronary heart disease is a very common condition affecting around 3.3 million people globally. CHD is sometimes called Ischeamic Heart Disease, IHD, or Coronary Artery Disease, CAD. Some people may also refer to it as heart disease. Coronary heart disease, CHD, is when your coronary arteries become narrowed by fatty material within their walls. These arteries supply your heart with blood containing high levels of oxygen. Over time, a fatty material called atheroma, sometimes known as plaque, can build up inside your coronary arteries. This process is called atherosclerosis. Eventually, your arteries may become so narrow that they cannot get enough blood to your heart. If a piece of atheroma breaks off, a blood clot, clump of blood, forms around this to try and repair the damage to the artery wall. This clot can block your coronary artery and cut off the supply of blood and oxygen to your heart muscle. This is known as a heart attack. CHD develops slowly over time, and the symptoms can be different for everyone. Some people do not know they have CHD before they have a heart attack. Angina is the name given for chest pain, or an uncomfortable feeling that happens when blood flow to your heart muscle is reduced. It is a common symptom of CHD. You might also feel pain or an uncomfortable feeling in your shoulders, arms, neck, jaw, back, and stomach. Other symptoms of coronary heart disease include shortness of breath, feeling faint, and feeling sick. Your doctor will discuss treatment options with you. We're explaining coronary heart disease in simple terms. Coronary heart disease, or CHD, affects millions worldwide. These may include medications, coronary angioplasty with or without a stent, heart bypass surgery. In addition to medications and procedures, your doctor will likely recommend lifestyle changes to improve the health of your heart. These include stopping smoking, eating a balanced diet, and staying physically active. There are different things that increase your risk of CHD. These include high blood pressure, high cholesterol, diabetes, smoking, living with excess weight or obesity, not doing enough physical activity, having a family history of CHD, getting older, and your assigned sex at birth. Living a healthy lifestyle can help lower your risk of developing CHD. There are lots of changes you can make. These include eating a healthy diet, staying physically active, quitting smoking, maintaining a healthy weight, reducing how much alcohol you drink. Your doctor will need to carry out a few tests to diagnose CHD. These tests are very common. Some of the tests include electrocardiogram, ECG, echocardiogram, chest X-ray, coronary angiogram, exercise stress tests, blood tests, radionuclide tests, MRI scans, CT scans. You can have a free NHS health check to assess your risk of CHD if you're between 40 and 74 years old and live in London, New York, Accra, Johannesburg, and some African countries. If you live in America, Egypt, Scotland, or Wales, please check with your health insurance scheme about assessing your risk of CHD. The health check usually takes place at your GP surgery. It lasts about 20 minutes. A healthcare professional, such as a nurse, doctor, pharmacist, or healthcare assistant, will check your blood pressure and cholesterol levels. They will also take a measurement of height, weight, and waist. Based on your results and lifestyle choices, they will give you practical advice about keeping your heart healthy. Some people think that CHD only affects men, but it affects women as well. There are over 1 million women living with CHD globally.